Good morning, class. This is Dr. Ramparsad speaking, and I am speaking about the coronavirus. Any question? Any questions?
Yes, Dr. Ramparsad. I have plenty of questions for you. What is a pandemic?
Pandemics are first classified as epidemics, then rapidly move their way across countries.
Okay, that's oh. What is the difference between the terms academic and pandemic?
The difference is an epidemic is a disease that spreads from person to person in a local area or community. Unlike the pandemic that goes into different phases, spreads over large areas, continents, or even the whole world.
Okay. When did the last pandemic occur and what was the name of the disease?
The last pandemic before coronavirus was the 2009 H1N1 flu pandemic, commonly known as swine flu, which infected an estimated 700 million people.
Whoa, 700 million. That's a lot. Another question for you. What is coronavirus?
Coronavirus, also known as COVID-19, is a respiratory illness that can affect lungs and airways.
Wow.
Here is a diagram of what the coronavirus looks under a microscope.
Okay. Where did COVID-19 originate?
COVID-19 was first discovered in Wuhan, China on December 2019. This is the map of China, and this is where Wuhan is. Scientists believe a bat likely infected another animal before it infected humans.
Wow, a bat. That's different. What does COVID-19 stand for?
COVID-19 stands for CO, corona, VI, virus, D, disease, 19, 2019.
Okay. So how was it transmitted?
When an infected individual coughs or sneezes openly in a public place, which billions of droplets come from their nose or mouth, that can land on a healthy person's body or surfaces such as tables, chairs, beds, money, etc., can be infected and also can survive up to several days outside the human body.
Okay. What? Oh,
So this is another example of how is it transmitted. If patient 0 coughs on 2 people and they each infects 2 people, it will continuously go on and on and on until the disease finally turns into an epidemic. Then if it gets around the world, it will soon turn into a pandemic.
okay. Okay. What are the precautionary methods stipulated by the WHO to help prevent its spread?
You can prevent COVID-19 by washing your hands thoroughly with soap and water for 20 seconds. Wear a surgical N95 or homemade mask. This is a surgical mask, the N95 mask, and this is a homemade mask. It is customizable. You can choose any patterns along with colors. And this is how you actually put it on. Make sure it covers the nose and mouth. Using hand sanitizer with more than 60% ethanol or 70% isopropyl alcohol. This is the hand sanitizer. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay warm if you are not feeling well. For the adults, refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people.
Okay. What does the term WHO stands for?
The terms WHO stands for World Health Organization. They help us prevent the spread of COVID-19. It was stated a pandemic by the WHO on March 11, 2020.
Okay. I have another question for you, doctor. List 4 items that COVID-19 have survived on for at least 5 days.
COVID-19 can survive on doorknobs, drinking glass, dishes, and newspapers up to 5 days.
Okay. What are the symptoms of the coronavirus?
The symptoms are fever, dry cough, shortness of breath, runny nose, sore throat, fatigue, and diarrhea.
Wow.
On my research of epidemic, pandemic, COVID-19 and WHO, I have learned to protect myself and prevent the spread of the coronavirus. Thank you, and I hope you enjoy my presentation.